I'm going to introduce Denise Bond, who's going to be talking today on common veterinary toxin emergencies and treatments. She is the lead emergency physician at the VCA Midwest Specialty Hospital and one of the prominent board members of the Bouvier Health Foundation. Denise, go ahead, get started.
Thank you. I was going to give a little bit of information on myself as well. I have owned Bouvier since 1986. I got my first Bouvier when I was a first-year veterinary student, and he accompanied me to school on many occasions to help me with studying, and I showed him to his championship. Over the last, now it's been almost 35 years or more, I've done a lot of different things with my Bouviers. I've done herding, done just fun agility stuff, but mostly showing and conformation, and have had some litters of puppies. So moving on to our topic here, it's about common veterinary toxin emergencies and treatments. So starting off, and I need to move to the next screen, so we're right there. So a definition of a toxin is a harmful substance or substances that are derived from food, water, cleaning products, or other environmental sources, which can be poisonous if they accumulate in the body and can lead to damage of vital organs or systems. So when we're looking at some of the common canine toxins, which is what I'm going to focus on today, there are several very common ones that we see quite frequently in emergency. Definitely there are hundreds of toxins overall, but these are some of the very common ones that we see, including chocolate, xylitol, grapes and raisins, which also includes curants and rodenticides, marijuana, which I think is one of the most humorous ones that we can encounter, as well as other human and veterinary medications and illicit drugs or substances. So first we'll start with chocolate. And why is chocolate toxic to dogs? It's one of the most delightful substances on the planet, no doubt, at least in my opinion. But why are they toxic? Chocolate contains substances called methylxanthines, which include compounds like theobromine and caffeine. Combined together, as they are in chocolate, it escalates the adverse effects. Theobromine is one of the main toxins in chocolate for canines. These substances are not easily metabolized by dogs, which leads to the adverse events or adverse effects seen. These substances have a multitude of effects, including diuresis, dilation of blood vessels, smooth muscle relaxation, and many, many other potential causes or problems. So how much of chocolate is actually toxic? It actually varies with the type of chocolate that we see. So the darker the chocolate, the more theobromine that is present. Baker's chocolate and the darkest gourmet chocolates are highly concentrated substances with 130 to 450 milligrams of theobromine per ounce. Symptoms of mild chocolate toxicity occur at 20 milligrams per kilogram of total methylxanthines, severe symptoms at 40 to 50 milligrams per kilogram, seizures at about 60 milligrams per kilogram, and death can occur at 100 to 200 milligrams per kilogram. But the lethal dose is actually very dependent upon the individual animal. Some dogs may be far more sensitive. In looking at the types of chocolate, white chocolate contains very little theobromine, as you can see from my graphic, only about 0.25 milligrams per ounce. For this type, fat and sugar can actually be more problematic, leading to gastroenteritis and pancreatitis in some individuals. When we look at Baker's chocolate, it contains 393 milligrams per ounce of chocolate. When we look at a 50-pound dog, ingesting only 1 ounce of Baker's chocolate could lead to lethal results. 9 ounces of milk chocolate to show signs of toxicity. For many dogs, ingesting a small amount of milk chocolate is not lethal, but they may only show signs of gastroenteritis. I think one important thing to keep in mind here, methylxanthines do cross the placenta and pass into mother's milk, so unborn and nursing puppies can indeed be affected. So what are the clinical symptoms of chocolate toxicosis? And it really depends upon the chocolate ingested, as you can see. Vomiting and diarrhea is going to be the most common symptom seen, but also increased thirst and urination, panting and restlessness from the stimulation to the central nervous system, tachycardias and tachyarrhythmias, meaning racing heart rates and heart arrhythmias. Severe toxicity can result in muscle tremors, seizures, and even heart failure. Death is a less common sequela, but it does occur with the highest doses. Protracted vomiting can lead to aspiration pneumonia, leading to respiratory distress. These symptoms can last anywhere from hours to even days. With higher doses, we will see what's termed enterohepatic recirculation, which means that as it goes through the bile and is dumped back into the intestine, it gets reabsorbed from the intestinal wall, which results in a perpetuation of symptoms. Another aspect of that is actually reabsorption from the bladder wall itself, causing prolonged symptoms. How do we treat chocolate toxicity? Well, it is actually very multifaceted. Generally, the first step is induction of emesis, even if the dog has done vomiting at home. Consider that induction of emesis is done with apomorphine, which stimulates more effective emesis, evacuating between 60 and 80% of the stomach contents. And as you can see, that's not complete evacuation of the stomach contents. We follow this with antiemetics to stop ongoing vomiting, which is generally done with Serenia, a very powerful antiemetic, and potentially other things such as ondansetron if it's needed. Once the vomiting calms, we provide the animals with activated charcoal, as this helps to bind any chocolate in the system and prevents or reduces the enterohepatic circulation. Because activated charcoal has been shown to cause increases in sodium levels, which can be harmful, we do monitor electrolyte status prior to administering it and during any subsequent doses of activated charcoal. This increased sodium can result in swelling in the brain, as the water will follow sodium into the brain, and that results in demyelination of nerves, which is a very, very serious complication. So often when we do have to provide the multiple doses, again, we have to monitor those sodium levels prior to the administration of each dose of activated charcoal. With more severe intoxications, we do recommend hospitalization, IV fluid support, monitoring heart rates, which sometimes at our clinic we will do with telemetry, meaning we'll put a vest on the animal and watch it on a big screen on a continual basis. Some animals may require urinary catheterization, especially if they're completely obtunded or lateral and not able to get up and be walked outside, or frequent walks outside to evacuate the bladder. Other symptomatic care should also be provided as needed, such as gastrointestinal protectants and antidiarrheals, which metronidazole is a very common one that we all know about. For high heart rates, we can provide medications such as propranolol to reduce the heart rate, or using things to provide sedation such as acepromazine, which you have to be a little bit careful with using acepromazine, as it could cause a drop in blood pressure. With some potential patients exhibiting the high heart rates, again, we put them on continuous ECG monitoring and intervene with the medications as needed. Antiarrhythmic medications has been needed in some instances, and that oftentimes is something like lidocaine given on a continuous rate infusion to control any ongoing arrhythmias. Xylitol toxicity, and as many people know, xylitol is in many different compounds, but xylitol toxicity, we really don't understand why there's a difference in dogs, why they have an effect with xylitol, because most mammals do not show any type of effect with it. Xylitol causes a stimulation of release of insulin that can cause a drop in blood sugar. With larger ingestions, greater than 500 milligrams per kilogram, we can also see liver failure. Again, the mechanism is not currently understood as to why this happens. Again, many products that are on the market do contain xylitol, including gum, with icebreakers being the worst, mints of various kinds, peanut butter, toothpaste, and even some human medications. And the point with the human medications, if indeed you need to pick up a prescription from a pharmacy for your pet, you do need to be assured that those that are compounded or liquid formulations don't contain xylitol. So xylitol clinical symptoms. One of the most common ones, again, is hypoglycemia or low blood sugar, which can occur within the first 30 minutes after ingestion if there is indeed sufficient amount ingested. Or it could be delayed up to 12 to 18 hours for that low blood sugar, as xylitol is in a substrate sometimes that is slower to absorb, such as some of the gum products. The clinical signs of hypoglycemia can include vomiting, weakness, ataxia, depression, low potassium levels, seizures, and even coma in some instances. Keep in mind that the brain is 100% dependent upon your blood sugar levels to function appropriately. So if you have a drop, hence that's why it leads to the CNS signs that occur. Signs of liver injury may actually not occur until 24 to 48 hours after ingestion of xylitol. Although increases in liver enzymes are often detectable within the first 8 to 12 hours of ingestions. Clinical signs of liver injury include depression, vomiting, icterus, which on the picture you can see the yellow portion in the whites of the eyes of that dog, coagulopathies due to low platelets, as well as a lack of ability to produce important clotting factors. Not all dogs that develop xylitol-induced liver injury develop hypoglycemia in the earlier phases. So xylitol treatment. For the treatment of xylitol, initially, of course, as in many cases, we want to induce vomiting to evacuate as much as possible prior to absorption. For many toxins, we utilize activated charcoal, but unfortunately, charcoal does not bind to this particular toxin. And even though charcoal has many benefits, again, it can be adverse as well, again, concerning the sodium levels. So vomiting up charcoal and aspirating is always a concern. So prior to administration, all of our patients are given Serenia. But again, we do not use activated charcoal with this one. And the mainstay of hospitalization and IV fluids are another thing used in xylitol toxicities. This helps to support the liver. Sometimes we do have to add dextrose if the blood sugar is low coming into the clinic. Generally, we will monitor the blood sugar for 12 to 18 hours, longer if there's a persistent hypoglycemia. In most cases, within 12 hours, the monitoring for low blood sugar can be stopped, and the dextrose in the fluids can also be stopped. Usually when we are seeing these patients, we do get baseline labs to examine the liver values and continue to monitor these every 24 hours. If the liver values elevate, we will continue to start with IV fluids and monitoring liver values until normal. Also, we will provide these guys with some hepatoprotectants such as denamarin to help support that liver function as well. Generally, if the dog is doing well at 48 hours, we will discharge with instructions to recheck at 3 to 5 days post-exposure, checking those baseline bloods again. In some cases, we will also start checking the coagulation factors if there's concern for serious liver injury, including the PT and PTT. In a worst case scenario, some of these guys may need to have blood products such as plasma transfusions to help support their coagulation factors. So the next one is grapes and raisins. That has actually become a very commonly known toxin for dogs over the past decade. Initially, the actual toxin was unknown, and we just had to treat knowing that there was something in there that was causing a problem. But in April of this year, the Critical Care Society actually presented a paper on this topic, believing now that the potential toxicant is tartaric acid and potassium bitartrate. This compound has been found in high concentrations in grapes, raisins, and currants. This particular substance has been found to be problematic primarily in dogs and causes acute kidney failure. The toxin will attack the renal tubular system within the kidney filtration system, primarily the proximal renal tubules, and can result in anuria, which is a complete kidney shutdown within 72 hours of ingestion. Once this process has started, management of this can become very, very difficult. Toxic amounts of grapes are around 1 to 2 grapes per 10 pounds, raisins around 0.11 ounce per kilogram. So again, how do we treat for possible ingestion of grapes or raisins? The primary means goes back to decontamination with induction of emesis as early as possible, and then activated charcoal administration at a one-time basis after giving Serenia or some type of antiemetic. These animals do need to be hospitalized for fluid diuresis for the time frame generally of 48 to 72 hours. Fluids truly are the mainstay of this treatment, as the fluid pushed through the kidneys tends to be protective, diluting out the toxin and increasing the GFR, or glomerular filtration rate, basically meaning how those kidneys are functioning. We start with baseline kidney values and recheck every 24 hours until discharge. Often it is best to reevaluate those kidney values at 5 days post-exposure. Some that have ingested very large amounts and exhibit elevations of kidney values will require even more prolonged IV fluid therapy, sometimes up to 3 to 5 days. In cases where we see complete shutdown of the kidneys or anuria, we may place these guys on a dopamine or furosemide constant rate infusion. While this is a somewhat controversial treatment as far as its effectiveness in reducing the kidney injury and getting those kidneys to function again, it's truly a last-ditch effort to try and push as much fluid as possible through the kidneys and keep them filtering. So rodenticides, this is a very common toxin in all of our households and even out in the environment. Generally, when we think of this, we think of things such as decon or tomcat, and most people believe the only issue for this toxin is causing bleeding disorders. Keep in mind, a number of years ago, the EPA pushed for changes in rodenticides and looked to use mostly a neurotoxin, believing wildlife and people would have lesser effects from it and less fatal effects. Unfortunately, this has made emergent care for this toxin a bit more complex and even a failure at times. So the more commonly known rodenticides has been the anticoagulant rodenticides. They're the first generation of anticoagulant rodenticides are from decades ago. The hydroxycoumarins, such as warfarin and coumarin, they are generally not used nowadays, although these and their derivatives are utilized in human medicine. These required multiple ingestions and were shorter acting, generally affecting the body systems for about 4 to 7 days. The second generation anticoagulants are more commonly used today, as well as danadiones. The second generation hydroxycoumarins are bromadiolone and brodifacoum. They require only a single exposure and show tremendous dose dependency, where symptoms may take even up to 2 to 3 weeks before presenting and can last as long as 28 to 35 days. So anticoagulant rodenticides, again, are first and second generation, with the second gen being utilized today. The clinical signs are related to bleeding and include depression or lethargy, weakness, pale mucous membranes, bleeding, such as along the gingiva, into urine, into the intestines, and truly the worst case scenario is into the chest and lungs. Clinically, these rodenticides will affect coagulation with prolongation of clotting factors such as PT and PTT. These factors don't affect platelets, which is a common misconception. We do run basic labs on these dogs to determine if there is an anemia from bleeding or if there's a secondary effect on internal organs, as well as possibly radiographs to look for other sources of internal bleeding. But again, the primary effect is with clotting factors due to an alteration of how vitamin K is recycled within the body. Treatment of these rodenticides includes administration of vitamin K for the duration of action of the rodenticide, which again on the second generation is going to be prolonged. Duration of dosing, of vitamin K3 is 5 milligrams per kilogram daily and should be given with a fatty meal to aid in absorption of this lipid soluble vitamin. Considering the long duration of these second generation rodenticides, we administer vitamin K3 for at least 23 days or 28 days, then retest the clotting factors PT and PTT, continuing vitamin K3 longer if needed. When clotting values are already prolonged, we will administer frozen plasma to replace clotting factors and stop bleeding. Even administration of plasma will take 8 to 12 hours to stop current bleeding. Administration of K3 will require far too much time to produce the replacement clotting factors, up to several days potentially, and the potential loss of the patient if the plasma is not administered. In some cases where internal bleeding has been protracted, administration of packed red cells may be necessary. General guidelines for blood transfusions start around a packed cell volume, which is the red blood cells versus fluid in the bloodstream, and about 20% if the animal is symptomatic, meaning they are lethargic, or for instance, kidneys or heart are not functioning appropriately, showing adverse effects, or below 15% in other cases. If bleeding has occurred into the chest, such as around the lungs or into the lungs, oxygen support, and even a chest tap may be needed to evacuate blood from around the lungs. In some cases where bleeding into the lungs has been very severe, positive pressure ventilation may improve our survival rates. Bromethalin is one of the newer rodenticides and is considered a neurotoxin. Indeed, this compound has been proven to be very difficult to treat, as there are no actual antidotes. This toxin is a lipid-soluble toxin, and once again, it crosses the blood-brain barrier, as lipid-soluble compounds do, and it causes an uncoupling of the oxidative phosphorylation, which results in the movement of sodium into the brain. Again, a very detrimental occurrence. As stated earlier, this excessive sodium will result in swelling of the brain secondary to an influx of water into the brain and demyelination of nerves. We will see progressive paralysis, respiratory arrest, and death. So, clinical signs. So with acute toxicosis, which it can be seen in 8 to 12 hours in cases where twice the lethal dose or LD50 is ingested, generally what we'll start to see is a hyperexcitability, muscle tremors, rear limb ataxia and weakness, seizures, and paralysis of the muscles for respiration, trending toward respiratory arrest. Chronic toxicosis can show up in 4 to 7 days with lethargy, progressive rear limb weakness, paresis, leading to paralysis, then respiratory arrest. So treatment is best done early with a calculation first of the dose that's ingested, decontamination using emetics such as apomorphine, then dosing with multiple doses of activated charcoal, generally every 6 to 8 hours, with the first dose containing sorbitol. It is vital to monitor sodium levels again prior to each dose of activated charcoal. The activated charcoal indeed helps to bind bromethalin and prevent that, again, enterohepatic circulation that occurs where the compound is dumped out into the intestine via the bile, reabsorbed through the intestinal wall, and goes back into circulation and back into the bile. Included in the potential treatment of this is a newer idea of using intravenous lipids. This is given first at a bolus dose, so a large amount, which is 1.5 mils per kilogram of body weight, given over the first 30 to 60 minutes. And then a continuous infusion of 0.5 mils per kilogram per hour over 2 hours. This can be repeated as needed while monitoring for the lipid levels within the blood. In humans, there was a concern about inducing pancreatitis, but it doesn't seem to be a definitive occurrence in dogs at this point in time. Marijuana. As we all know, with several states having adopted marijuana laws, and even in states that haven't, this is becoming one of the most common intoxicants. Symptoms can occur with doses as low as 3 milligrams per kilogram, but lethal doses are considered 3 grams per kilogram, which is, if you calculate that out, that's a lot of THC. Very difficult to get that kind of toxicosis. Symptoms generally seen within 30 to 60 minutes of ingestion and can include a variety of different symptoms. Exposure can occur in many ways, not just from ingestion of the flower, but also with smoking and with edibles. One interesting fact that many may not take into effect with marijuana is significant levels of THC will remain in ash residue after smoking and can still cause toxicosis in dogs and cats. This is primarily because of the difference in receptors in the body for a dog. So there are 2 different receptors in the brain, a CB1, which is within the brain itself, and a CB2 that is in the peripheral tissues, which the CB2 is more for the immune system and for pain relief. Dogs have more cannabinoid receptors in the brain than people do, so the effects of cannabis are far more profound. Smaller amounts of cannabis can result in symptoms. Generally, the most common symptoms we see are slow heart rates, low body temperatures, ataxia. So these guys are stumbling as they're walking. Some are vomiting. We see the mydriasis, or the dilated pupils that people have. We see hyperesthesia, which is actually an overreactivity to sounds and movements around them, hypersalivation, disorientation, and urinary incontinence. In other words, they're dribbling urine. Quite often, these dogs are presented to the emergency room for quote unquote seizure activity due to the ataxia and due to the hyperreactivity to the surrounding sounds and movements. There are means to detect actual THC. The human urine tests are available, which can be bought over the counter and can be utilized, but oftentimes will come up as false negative, especially if you try to read them too early into the process. But also, dogs produce a different metabolite than what is tested in that kit. So it may not be able to pick up in dogs that are later on in the exposure. There is an ELISA test available, which is a blood test that's highly accurate, but in most cases, it's very easy to diagnose based on the presenting symptoms. And if the owners will actually admit it to you, you can diagnose it based on that. Oftentimes people think we're going to turn them in, which we have no interest in doing that. We just want to treat the dogs. So marijuana treatment, it truly does depend on the exposure and symptoms seen. So as I stated earlier, the dogs are affected more profoundly with marijuana, and the symptoms occur at lower exposures. Edibles, though, due to the concentration of THC and add to that the lipid carriers such as butter, will often result in even more severe clinical symptoms. The treatment of an edible can oftentimes require more aggressive treatment with hospitalization, potentially IV fluids, and other things. Most treatment otherwise is symptomatic and supportive. Again, induction of vomiting can be performed, but you need to catch this early, as truly marijuana is an antiemetic itself. So you'd have to catch it within the first 30 to 60 minutes. Mild cases can oftentimes be treated as an outpatient with such things as meropitant, because even though it is an antiemetic, some of these dogs may have vomiting associated with it. Hyperemesis is definitely a side effect of marijuana. And sometimes we'll give them some fluids under the skin to help with excretion of the THC, and activated charcoal to bind to any THC that's ingested. This should only be considered in patients, though, that are conscious and mildly affected, as again, if we start to have issues with vomiting or reflux into the esophagus, we could end up with aspiration pneumonia in these individuals. For the more severe cases, again, inpatient treatment is considered a must. Those that have ingested edibles, especially the homemade edibles where an actual concentration is not known, may even present comatose or nearly comatose, and the duration of symptoms can be 24 to 36 hours or sometimes even longer. Again, fluid support with IV fluids should be considered for these individuals. And we also want to support their blood pressure and heart rate, give them heat support as needed for low body temperatures. If they're experiencing muscle tremors, which is a component oftentimes of the hyperesthesia or hyperreactivity, we can use benzodiazepines for that aspect of it. And once again, our lovely little IV soluble lipids to bind to the THC and help with more rapid excretion. In some cases, if there are neurologic symptoms such as seizures, which does happen from time to time, again, it's a lipid-soluble compound and crosses over into the brain, we can use anticonvulsants, including things such as phenobarbital, or even a constant rate infusion of a benzodiazepine such as Valium or midazolam. So human and veterinary medicines, there are a lot of common medications out there. Most of them are not commonly ingested by dogs. I think the most common that I have seen overall are going to be the various types of non-steroidals, which can indeed be highly toxic to animals. Ibuprofen is a big one that people use and dogs get into. They leave it in their purse or whatever on their nightstand sometimes. Or maybe when their animal is not feeling right, they decide to go ahead and give them a dose of ibuprofen, not realizing that dogs metabolize these drugs a little bit differently and don't handle them the same as people do. I think one of the worst ones is definitely naproxen. Naproxen has a very narrow margin of safety. And in reality, they say there's no safe dose of naproxen. Sometimes we can have tolerable doses of things like ibuprofen. But when you get to the higher doses with these types of medications, the symptoms can include lethargy, vomiting, diarrhea, dark tarry stools, which is typical of GI ulceration and even perforation, sometimes anemia, abdominal pain due to the liver injury and the GI effects, decreases in appetite. And with the higher doses, especially with ibuprofen, seizures can be seen. Usually those higher doses are well over what we typically will see with this type of thing. So again, what's the treatment for ingestion of non-steroidals? That will include decontamination with induction of emesis, activated charcoal. With some types of NSAIDs, we will give multiple doses of activated charcoal, generally every 6 to 8 hours, to again prevent the enterohepatic circulation that occurs, monitoring their blood values and electrolytes, including liver and kidney values, and then symptomatic treatment for any GI symptoms. So providing medications such as antacids, possibly something like misoprostol that can prevent ulceration formation, sucralfate, which can help protect the stomach wall from perforation. Those are the big types of things. But sometimes, especially with these NSAIDs, we can see even worse GI effects, including GI perforation. Oftentimes that's in the gastroduodenal area or the first part of the small intestine. That oftentimes is going to require exploratory surgery to try and save the animal. Again, I've long advocated against the use of medications such as Deramax, having seen multiple animals who have on normal prescribed doses and once even with one dose develop a perforation of the duodenum and pass away. So again, you have to be careful about what medications you're going to use. And indeed, there are differences in the sensitivity between different animals. Some of the other common medications that we can see, whoops, it's not the one, can include things like amphetamines, Adderall or Ritalin. Those can be very commonly seen. And again, some of the symptoms are going to be very, very typical of most amphetamines. That can include hyperactivity, restlessness, increased heart rate and heart arrhythmias, increased blood pressure, increased body temperature. All of those things can be rapidly occurring after ingestion, usually within 15 to 30 minutes, and sometimes can last as long as 12 to even up to 24 hours with some of the sustained released types of medications. The treatment, again, is pretty basic. It's straightforward as far as decontamination, trying to get that out of the system if it's presenting to you soon enough. IV fluid support, which not only helps with elimination of the toxin, it also supports the liver, supports the kidneys, and it helps us support the blood pressure. We want to monitor the blood pressure, as these guys can have very high blood pressures. They can also have very low rebound blood pressures. Treatment of the high heart rates, which includes using medications such as beta blockers. Our common one utilized is propranolol. Dealing with any arrhythmias seen, which again, tachyarrhythmias can occur, and lidocaine can be needed for some of these guys. And in some cases, sedation. Our common sedative used for amphetamines is actually going to be acepromazine, but once again, while it provides this good sedation and it works well with these medications, we do have to be careful not to have the alternative response, which can mean low blood pressure in these guys, and one additional thing that you have to deal with. So those are my common medications and adverse events, and if anybody has any questions, I would be happy to answer them.